Now that we know why we need nutrients and how they get to our cells, we need to focus on how to get air, or more precisely oxygen, into our body and to our cells. That's the job of the respiratory system. The nasal cavity is a wind tunnel, and it's guarded by hairs that remove large particles from the air as you breathe in. Things like pollen grains, skin flakes, and dust. So there are 3 tasks that happen in the nose. You filter and clean what comes into your nose, and those trapped particles stick to mucus. That combo, we call it snot. The second task is that the air is warmed, and the third task is that the air is moistened. Your nasal cavity is also lined with olfactory epithelial tissue, allowing you to respond to odors from rotten eggs to roses. If you were to look down the trachea or windpipe of a living person, you would see its pink lining covered by slimy mucus. Go ahead, put your hand gently at your throat and feel the rings of cartilage tissue. These stop the trachea from collapsing when air rushes in. Swallow now as you feel your throat. You may feel the voice box or the larynx. This funnel-like cartilage contains sound-producing vocal cords, and as air passes over the vocal cords, they vibrate, producing sounds we turn into speech. At the center of the respiratory system are the lungs. Humans have 2, with the right lung being slightly larger than the left lung. That right lung is divided into 3 lobes, whereas the left is divided into 2. Your lungs work together with your heart, your blood, and blood vessels to send oxygen to all your body's cells. Together, these organs and your blood vessels are called the cardiovascular system. The lungs' job is to take in oxygen from the air and get rid of waste carbon dioxide. So just how are oxygen and carbon dioxide exchanged? Let's take a deep breath and get started. Small sacs called alveoli or alveoli allow oxygen molecules to pass through their moist lining into the capillaries or capillaries of the bloodstream. Carbon dioxide waste molecules pass in the opposite direction. The 300 million alveoli in both lungs provide a massive surface area for gas exchange. Your lungs are a passive bag of spongy tissue, meaning they cannot expand or shrink of their own accord. Getting air in and out involves the diaphragm. It's a smooth muscle that helps you breathe. When you inhale, the diaphragm contracts, and the intercostal muscles, that's the muscles between your ribs, pull the ribs up and outward. And as the chest expands, the lungs also expand and suck in air. Try it. Take a deep breath. During exhalation, the diaphragm and the intercostal muscles relax, forcing your air out. At rest, the diaphragm does most of the work of breathing, thanks to your brainstem, the autopilot of the brain. During exercise, however, you need more oxygen. The intercostal muscles step up their efforts and get extra oxygen into the lungs to stop you being out of breath. Your nasal cavity does a pretty good job of cleaning the air. However, sometimes irritations need to be removed forcefully, so we sneeze. Air builds up behind the vocal cords and is suddenly released. This blasts air out at high speed, up to 100 miles an hour. Particles can travel 30 feet. That's the length of the classroom. Although they seem gross, sneezing is an important part of keeping us healthy. Well, maybe not for our neighbor. Up to 100,000 germs, viruses, bacteria, can be released into the air from a single sneeze. Ugh. Want to know more about the respiratory system? Check out this YouTube video.
In order to stay alive, the body has to breathe air. We breathe in oxygen and we breathe out carbon dioxide. This process is known as respiration. Breathing happens automatically. Every day, the body breathes about 20,000 times. By the time we reach 70 years old, that's about 600 million breaths. All of this breathing occurs because of the respiratory system, which includes the nose, throat, voice box, windpipe, and lungs. At the top of the respiratory system, the nostrils bring air into the nose, where it's filtered, warmed, and moistened. Tiny hairs called cilia protect the nasal passageways and other parts of the respiratory tract and filter out dust and other particles that enter the nose through the breathed air. Air can also be breathed in through the mouth. The two airways of the nose and mouth meet up at the pharynx, which is located at the back of the throat. The pharynx carries both food and air and is used for digestion and respiration. One path is for food. This is called the esophagus, which leads on to the stomach. The other side is for air. It's called the trachea. A small flap of tissue, called the epiglottis, covers the air-only passage when we swallow. This stops food and liquid from going into the lungs. The larynx, or voice box, is located at the top of the trachea, the air-only pipe. This is where our vocal cords are. The trachea, or windpipe, which is a 2 to 3 centimetre tube, then extends downwards from the bottom of the larynx for about 12 centimetres. The walls of the windpipe are made strong by stiff rings of cartilage that keep it open. The trachea is also lined with tiny hairs. They sweep foreign particles and fluids out of the airway, keeping them from entering the lungs. The windpipe divides into two branches, and each one of these enters one of the two lungs of the body. Each branch resembles the limbs of a tree dividing into smaller, finer branches called bronchioles. The bronchioles end in tiny air sacs called alveoli, which look a bit like grapes. These structures enable fresh air to get to the air sacs, which are surrounded by tiny blood vessels or capillaries. The oxygen passes through these air sacs and travels through the capillary walls into the bloodstream. At the same time, carbon dioxide transfers from the bloodstream into the air sacs, where it gets breathed out of the body. When we exercise, the body needs more oxygen to feed the muscles as they work harder. The body responds by breathing more quickly and deeply. As the cells of the muscles use up more oxygen, the lungs have to work harder to keep up the supply. The respiratory system then speeds up to supply the body with much needed oxygen, and also to get rid of the carbon dioxide waste in the system. Over time, exercising also helps our chest cavity to get bigger, which enables the body to increase the amount of air it takes in. More capillaries form around the air sacs, so the body gets better at swapping oxygen and carbon dioxide gases. We can see how the body's respiratory system helps the body to move about, and is influenced by regular and ongoing physical activity as well.